Interstitial cystitis, bladder pain syndrome, IC, BPS, is a chronic and often debilitating condition. Characterized by recurring pain, discomfort, and urgency related to the bladder and pelvic region. This condition primarily affects women but can also occur in men. The exact cause of IC, BPS remains elusive, and its diagnosis and management present challenges due to its multifaceted nature. This video aims to provide a comprehensive overview of IC, BPS, focusing on its symptoms, diagnostic methods, and the various treatment options available. Symptoms. IC, BPS manifests through a range of symptoms that can significantly impact an individual's quality of life. Some common symptoms include pelvic pain. Chronic pelvic pain is the hallmark of IC, BPS, which can vary in intensity and location, often resembling a burning, stabbing, or cramping sensation. Bladder urgency and frequency. Frequent urges to urinate, even with small amounts of urine, are common. Patients may also experience nocturia, frequent nighttime urination. Painful urination, dysuria, or painful urination, is a prevalent symptom in IC, BPS patients. The pain can be localized in the urethra or lower abdomen. Bladder pressure. A sensation of pressure or fullness in the bladder region may persist, leading to discomfort. Pain during intercourse. Many patients experience pain during sexual intercourse, dyspareunia, which can further impair their quality of life. Fluctuations in symptoms. IC, BPS symptoms often follow a chronic, waxing, and waning pattern, making it challenging to predict when symptoms will exacerbate. Diagnosis. Diagnosing IC, BPS can be challenging due to its overlapping symptoms with other urinary and pelvic disorders. The diagnosis typically involves the following steps: medical history and symptom assessment, detailed questioning about symptoms, their duration, and their impact on daily life is crucial. Physical examination. A physical examination helps rule out other conditions and assess tenderness or discomfort in the pelvic region. Diagnostic tests. Urine analysis, to rule out urinary tract infections or other abnormalities. Cystoscopy. A thin tube with a camera is inserted into the bladder to visualize its lining. While not definitive, certain findings can suggest IC, BPS. Potassium sensitivity test. Installation of potassium chloride into the bladder to assess for pain and discomfort, which is more common in IC, BPS patients. Exclusion of other conditions. Other conditions with similar symptoms, like urinary tract infections, endometriosis, and pelvic floor dysfunction, must be ruled out. Treatment options. IC, BPS treatment aims to alleviate symptoms, improve quality of life, and minimize pain. The approach can be multidisciplinary and patient-specific. Lifestyle and dietary modifications. Bladder training. Scheduled voiding helps regulate bladder function. Dietary changes. Avoiding trigger foods, such as caffeine, alcohol, spicy foods, that exacerbate symptoms. Stress management. Stress reduction techniques to manage symptom flare-ups. Medications. Pain management. Over-the-counter pain relievers or prescription medications can provide relief. Bladder coatings. Medications that create a protective layer in the bladder, reducing irritation. Muscle relaxants. Medications to alleviate pelvic muscle spasms. Physical therapy. Pelvic floor therapy. Strengthening and relaxation exercises to improve pelvic floor muscle function. Minimally invasive procedures. Bladder installations. Medications, such as lidocaine, are instilled directly into the bladder via a catheter. Nerve stimulation. Techniques like sacral nerve stimulation may modulate bladder function. Surgical interventions. In severe cases, surgery might be considered. Options include bladder augmentation or removal, cystectomy. Alternative therapies. Acupuncture. Some patients find relief from acupuncture sessions. Herbal supplements. Certain supplements like quercetin and aloe vera are proposed to have anti-inflammatory effects. Conclusion. Interstitial cystitis, bladder pain syndrome is a complex and debilitating condition that affects millions of individuals worldwide. Its exact cause remains unclear, which complicates its diagnosis and treatment. With a multifaceted approach involving lifestyle modifications, medications, physical therapy, and even surgical options, patients can find relief and regain control over their lives. As research continues to unveil the underlying mechanisms of IC/BPS, the medical community strives to improve diagnostic accuracy and develop more targeted and effective treatment strategies. Thanks for watching this video.